So, Dr. McDaniel, we know I've treated a number of professional athletes. We've had the experience of taking children that have had a baby tooth pulled to make room for the permanent teeth, and straight from the dentist, one hyperbaric dive, we get no redness, swelling, and pain. The child never needs to go on to any drugs or opioids. And of course, we've got an opioid crisis going on in our country. But it's been unbelievable to me that research is clearly showing that hyperbaric oxygen is a major anti-inflammatory. It kills the two of the major inflammatory proteins are known as hypoxic-inducible factor 1 alpha and beta. Also, transcription factor NF-kappa beta are also always around any form of inflammation. There's a long name. The von Hippel-Landau reaction is how this is destroyed by oxygenating these tissues. And I know that your product has some anti-inflammatory effects as well.
Well, first let me say, in the early days of the attempting to make a drug from the active ingredient aloe vera, we thought we had the most incredible boost to the immune system that it is. And we did a lot of studies that viruses, bacteria, parasites were not killed like drugs do that organism, but boosts the body's ability to attack and destroy it and inactivate it and take it apart.
Yeah.
And we thought we had something just incredible for that, and we called it an immunostimulant. Then we started hearing from people with asthma, autoimmune diseases, arthritis, hypothyroidism, a whole dry eyes, dry mouth, Sjögren's syndrome, various, there's about 80 autoimmune diseases. And what it is, the antibody that's against you, that your body makes, attaches, it cross-reacts. It was originally to the cell wall of a bacteria or some infectious agent, but it doesn't quit after it's gone. It doesn't quit, the body doesn't quit making that antibody, and it gets higher levels, and it starts attaching to different tissues in your own body. And when it attaches, the immune system, as it goes around the white cells and such, inspecting things and see this extra molecule on there, they say this is not normal, and it attacks and gives inflammation. Well, we have seen a host of virtually all the autoimmune diseases respond to giving this, and I was so bewildered that I went to a conference in Jerusalem, of all places, just on cytokines, interferons, and mechanisms of the body's. And one of the things it pointed out is that to turn on the immune system is a multi-step process in biochemistry, but you have to have nutrient molecules to do that, which we obviously knew we had. But to turn off an overactive or fighting immune system, you need molecules made to downregulate it in steps. Yeah. And what we were providing were nutrient molecules to downregulate when it's inappropriate to still be making antibodies to some infectious agents that are now still being made that attach to your own tissues. And some of the, particularly asthma, fact is I frequently tell people that I met my wife through that because her daughter was below 10 years of age, had been nearly died in the ICU unit with status asthmaticus, with a heart rate over 200 for extended hours, and that's the way they die, of a fatigued heart. Well, she read some of our research and all of how it was happening in autoimmune. She says, this might help Rosie. Yeah. And so she went back to Oklahoma and started on her when she was little, and now she's about 30 years old. She's not been in the hospital or a doctor's office with asthma since.
Well, most of the people...
Well, let me finish this.
Sorry, go ahead.
She did so well that her mother and I just got married. That's the end of the story.
Well, that's pretty good.
Yeah.
But Doc, most people here in Florida, and I'm sure in Texas, recognize the fact that aloe is a major, well-known anti-inflammatory to sunburn.
Oh, yes.
I mean, it's just commonly known that we get rid of the burn of sunburn. And so almost everyone that lives in Florida or any of the Sunbelt areas have learned that aloe is a major anti-inflammatory for the burn of the skin and sun. So most people can relate to that.
Yes.
Yeah. Well, thank you.
Yeah.